All right, so your costs and expenses when you're on Medicare. Part A, again, is going to be your inpatient care. And I'm not going to get into the exact dollar figures on this, but if you end up in the hospital, you're going to have a deductible. That deductible is going to cover you for a certain amount of time while the rest of your care is covered while you're in there. If Part B is essentially an 80-20 kind of arrangement. So if you go to the doctor's office and it costs you $100, Medicare is going to pay 80% of it, and you're going to end up with a bill for 20% of it. Part D, Medicare doesn't actually cover drugs, but it does regulate the companies that can cover your drugs and how they do that. So Part D gets a little bit more complicated. There are 4 stages to drug coverage under Part D's rules. So the first stage is going to be your deductible stage. Your plan may or may not have a deductible. It can be over $400 for that deductible for your Part D drugs. After that deductible stage, then you're going to be in your initial coverage stage. And this is where your drug plan is going to help you with the cost of your prescription drugs. This is where your Part D plan is going to help you with your prescription drugs. And you're going to have either set copays or co-insurance for your particular drug based upon the tier it is in, based upon the cost, based upon a lot of different factors. If you get to the point where you have taken over $4,000 worth of prescription drugs retail cost for the year, then you're going to go into the gap of the donut hole. While you're in the gap of the donut hole, under the new rules, you'll pay 25% of the cost of your prescription drugs, except in a couple exceptions, such as insulin or a couple other areas such as low-income subsidy or extra help. So it's much more complicated than just saying that you're going to pay 25%. If your drug costs do go high enough, the number is somewhere over $6,000 for the year, then you're going to go into catastrophic coverage where you're going to have much lower copays for your prescription drugs. Again, I'm not going to go into the exact dollar figures. It depends on the person and your situation. But all of these costs, this is where a Medicare plan comes into helping you control these expenses. The cost for a hospitalization may be much lower, will be much lower, depending on what plan you choose. The cost of a doctor's visit can be as low as no copay, depending upon the plan you choose. Your premiums can be $100 a month. Your premiums can be no dollars a month. Your premiums could be much higher. You might actually receive a refund of part of your Part B premium, depending on which plan you choose. So there are a lot of costs and expenses associated with your medical health insurance, your medical coverage after you're on Medicare, whether you're over 65 or under 65. And this is where we have the expertise to be able to come in and help you out and explain help you to understand your exact situation and the ways that we're able to assist you in controlling those expenses. Again, please reach out to us on our contact page. We'd be more than happy to come out and talk to you, explain the situation to you, and help you find a solution that is fitting for your needs.